So I initially found out I had TTP in 1995, and the first signs were big colourful bruises on my legs, and then I was starting getting tiny little pinprick red dot rashes on my feet. So common symptoms of someone experiencing TTP, so common symptoms are recorded as being confusion, slightly paranoia, so having a sort of a slight obsession with something, or a sudden obsession, bruising, pinprick rash, stomach upset, headaches. These are the range of things that can be indicative of a TTP episode. So when I was admitted to hospital, I had full blood counts done every day. It was about a week before TTP was diagnosed, so it was really simple tests, and they were just watching me every day. It was about a week in total from when I first went to the GP to when TTP was diagnosed. The first time I had TTP, the treatment was a really old-fashioned form of plasma exchange using a dialysis machine, and so I had that with fresh frozen plasma every day for at least a week. And I also had steroids, prednisolone, and folic acid. They were the core treatments. For my first episode of TTP, I was in hospital for 4 weeks. The first week I was on a general ward. I spent 2 weeks in ICU and then another week on a general ward. And it was very confusing. There was only probably a week of that time when I felt very ill and I wasn't really aware of what was going on. The rest of the time I was quite fully conscious and quite aware of my surroundings, even in ICU. So once I was discharged from hospital, I was at home, but I was still returning 2 or 3 times a week for plasma infusions. I was very, very tired. I felt very, I suppose, traumatised is the best word to describe it, because I felt as if my whole world has just been thrown upside down. I was off sick from my job and everything was different. I usually say to my family and friends that TTP isn't contagious when I'm describing it, because I think that's often a worry when it's a blood disorder. And I usually say, if they think of leukemia, because that's very well known and it's similar in the way that you can recover, but that it might come back. And I normally try and show a comparison to leukemia, because that's something that most people have heard of. I think connecting with other people who have TTP can be really empowering. It can make you feel less lonely, but there's also a risk that it can be quite scary, because there's lots of horror stories out there, especially in the World Wide Web. And so I think it's important to get information from a reliable source, and with a scientific base, rather than just people's individual experiences, because everyone's experience can be so vastly different. If I could share one thought with someone who'd been diagnosed with TTP, it would be to listen to your body. And if you feel unwell, go and get a blood test. Just a full blood count will give enough information that there is even something slightly wrong. So just keep an eye on yourself and don't delay. If you do feel you're relapsing, say you're seeing lots of bruising or the pinprick rash, then don't be scared. Just go and see a doctor, because the sooner you get it treated, the better the outcome. So my life has changed completely. I think it's split into before TTP and after TTP. I was very, very shy before I had TTP, and TTP's given me a reason to have confidence, and I speak for a living, really. So in ways it's the same. There's nothing I don't do, but I just get more tired. And when I'm tired, I struggle to find the right words, and my memory is very poor, so I rely a lot on notes and photographs and lists to get me through. A TTP diagnosis doesn't need to hold back your life. I think the important thing to remember is if you feel unwell or you've got any of the symptoms, to go and get that seen to by a doctor. But as long as you're aware of your body and as aware of when you're feeling unwell, you can still do all the things that you did before. You can still travel, you can still work, you can still do sports. There should be nothing that you can't do, providing you're fit and you're healthy between TTP episodes. And you might never have TTP again. It doesn't happen to everybody. Not everybody relapses. For most people, TTP would be quite a sudden onset, so it'd be quite traumatic. And any trauma, really, I think it's understood, it's accepted that it takes about a year for your body to recover. And I would say a good year before you're starting to feel life's falling back into place. But the important thing is to take it at your own pace and to ask for help, and at work to explain that you need your hours adjusted or your workload adjusted, and to be honest about how you feel and how you're coping. My hope for the future would be that you can pop one pill maybe once or twice a day, and that's TTP sorted. Maybe aspirational.